Okay, everyone, today we're going to start out by talking about the surge and travel paste. So these are our two new pastes that we just launched, and we'd like to give you guys a little bit more information about them and how to administer them and how they can benefit these competition horses. So we'll start out with a surge. So the primary purpose is to support the lung health by promoting normal alveolar capillary pressure. It enhances blood flow, increases oxygen utilization, increases stamina endurance, and supports the body's utilization of other supplements. So the surge actually has a delivery carrying property. If it's paired with any other supplements, say like our OrthoMax or our Nutrimix Plus, it's going to help carry those essential nutrients into soft tissue, into the foot, the lamina, etc. So it has a couple different uses. We're going to start out with what we use it for in the EIPH or the respiratory area. So when to use horses that have had previous EIPH or exercise-induced pulmonary hemorrhage, horses that are under strenuous activity, horses with COPD or other breathing disorders, and competition horses needing more stamina and endurance. So horses like race horses, barrel horses, eventers could benefit from this paste. So horses must take a breath with each stride during galloping, which leaves only a short time for inhalation and exhalation. So what I wanted to show everyone with these two photos, looking at the photo on the left first, you have the alveoli air sacs here. And those are deep inside the lungs where the oxygen is transferred from the lungs into the blood through the tiny blood vessels or pulmonary capillaries. So the pulmonary capillaries are these little tiny blood vessels that surround these alveoli air sacs. And just to give you a little perspective, these tiny little blood vessels are very thin. They are 50 times thinner than a human hair. So here on the right, you have the human hair. And over here where the arrow is pointing, you have the pulmonary capillary wall. So 50 times thinner than human hair. You can imagine the pressure that goes on inside these pulmonary capillaries. Very high chance of those rupturing. So therefore, reducing the blood pressure within these capillaries is extremely critical. Surge paste will help reduce that blood pressure, and it will also improve the oxygen utilization within these capillaries. So how to detect EIPH or exercise-induced pulmonary hemorrhage. So on the right, you have a veterinarian performing an endoscopic exam, which is what you see a lot on the racetrack. They'll have it set up after the horses have run to check to see if the horses have bled. So over on the left, you have 6 different images. These are 6 different horses. The endoscopy exam was performed 60 minutes after strenuous training was completed. And all of these cases had 0 signs of blood actually coming out of the nose. So you can see in the diagram A, there's just a small amount of blood, and B, it kind of progressively gets worse. But then again, even with this high amount of blood into the trachea, there was no blood coming out of the nose. So actually, there's less than 5% of horses that actually bleed out through the nose. So that's a very small percentage. So that means that there is a lot of horses out there that are potentially bleeding, and the owners or trainers might not know. So any breed, age, or discipline participating in any type of strenuous activity likely suffers from some degree of exercise-induced pulmonary hemorrhage. This endoscopy exam is a long, thin tube with a camera on the end that goes in through the nostril and passes into the upper airway and the trachea to see if there's any blood. So definitely recommend that if you're curious if your horse might be bleeding. So some signs of EIPH is clear white nasal discharge or blood coming from the nose, but we know, after exercise, that's less than a 5% chance of that happening. If the horse comes out and coughs after exercise, a disappointing performance. So in, the barrel horses, if those horses are raising their head or elevating, trying to kind of get air while they're competing. So typically a lot of horses will kind of bow off that third barrel and elevate their head. Or after the exercise, blowing for a long period of time or poor recovery. So it just seems like they're winded for an immense amount of time or more than usual. And then another sign would be frequent swallowing during cool out. So if you just see your horse constantly swallowing, there can be blood in that trachea or that windpipe. I used Surge on a mare that had previous EIPH, and she ran on Lasix. The first time I used it at a competition, we ran her without the Surge the first day, and she was very sweaty. She was very anxious. She had kind of like these blood vessels popping out on her neck. She came out of the arena and she was very winded and labored. Breathing seemed to kind of recover poorly. And so the next day we administered the Surge 1 hour before, and she did not have that excess amount of sweating. She was a lot more calm. And then she seemed to come out of the arena and not be as labored breathing. So it was just easier on her. So by decreasing that blood pressure, she was able to kind of stay calmer, less pressure, down into the lungs, and she recovered better. And then her performance did increase. So that's just a little tidbit story of a personal experience that I have. And then we'll go into how to administer the Surge paste. So we recommend, so the Surge paste is 50 mil or 100 mil tube, and you'll take 50 mils, which is half a tube, and administer it 1 hour prior to competition. It can be used in conjunction with the Lasix. And then another chance to use the Surge is for a horse that possibly might be in a laminitic state. So if they have laminitis that kind of flares up and say they're not eating, you need to get this on board very quickly, because this is going to help promote blood flow down to the foot and then also decrease some pain associated with that. You can orally dose the Surge morning and night for 3 days. And then you can switch over to the Surge powder once the horse is more comfortable and extend the treatment there. So what to do? Lasix is the most popular management prescribed by veterinarians. So this decreases EIPH from 50 to 90%. Our Stride bleeder protocol consists of the Surge paste as that pre-race 1 hour before, 50 mils to decrease the blood pressure within the lungs and those capillaries. And then the Lifeline given on a daily basis. So this is going to improve the overall health of the lungs, decrease inflammation, anything that's going on in that respiratory tract. And then by improving the health of the lungs, what we're going to do is increase the elasticity in those capillaries. So allowing them to withstand more pressure, make them stronger, that kind of thing. And then the Surge is decreasing the blood pressure. So it's kind of 2 parts. You'd give the Lifeline daily. For bleeders, we'd recommend 2 scoops a day, more of a performance dosage, and then the Surge pre-race. Pricing is $48 per 100 mil tube. So that's 2 doses, and this is show safe. So it will pass all regulations in the FEI and any type of drug testing that's going on the racetrack. So it's completely safe as far as all the ingredients in there. So now on to the travel paste. So this is a new formula. Its primary purpose is to encourage drinking and hydration. It helps prevent muscle fatigue, enhances the immune support with powerful antioxidants during travel stress. You want to keep that immune system up. And then it also helps with the recovery and competition associated with that travel stress. So all 3 of these pictures here are definitely a stressor for these horses. You have the trailer stress, you have competition where the horse is perspiring and sweating, and then also drinking afterwards to maintain that hydration. And then you have some pictures, a picture of horses stalled at a competition where they're, stressed, it's a different environment and whatnot. So horses, a lot of times people think, when they're in the trailer, they're resting, it's a 5-hour drive and then they can get out and compete. It's very important to maintain the glycogen utilization within those muscles. So anytime a horse is under stress or using their body in any type of strenuous activity, they're depleting the tissue of that glycogen. So the travel pace is going to help keep that glycogen in the tissues. And then once you get to a show, that way your horse is stepping off the trailer fresh and ready to compete. And then if you're at a 3-day show, it's going to help with the recovery after, each competition and making sure your horse is fresh and ready to go every day. So it's going to increase the hydration and thirst. But what it's also going to do, even for those horses that are drinking, it's going to help that water actually get into the cells for cellular hydration. So that way it's just not passing through the horse and not getting to where it needs to go. So your horse is going to become more hydrated. After strenuous activity, it actually takes about 2 to 3 days for a horse to replenish all of their glycogen back into the tissues. So it's very important to have this paste on board to help speed that process up. And then it also takes twice as long for a horse that's dehydrated to replenish that glycogen into the tissues. So hydration, replenishing that glycogen into the tissues is extremely important. And then we do have some vitamin E and C in there to help with that immune system. There's some BCAAs that help with the metabolic pH and that muscle fatigue. And then some electrolytes to help with replenishing what was lost during competition. So we recommend to orally dose 50 mils. So these are 100 ml tubes. So that would be half a tube morning and evening, beginning 2 days prior to travel. If your horse is already on our TurboMag BCAA powder, then you could just administer this the morning of before you leave. And then if it's an extra long haul, you can wait and about every 4 hours, administer another 50 mils. And then again, when you arrive. And then once you get to the show, we recommend the 50 mils in the morning and then a 50 mils at night to kind of help prep for that competition and then also with that recovery. So the cost per tube is $29 for the 100 ml tube. And then this is also show safe with any drug testing regulations. So you're safe there. And then I just wanted to touch base a little bit on our new Travel Ready program. So this will be 1-day packages that can be purchased. In that 1-day package, it will include 2 1-pound packets of the GastroFix, 2 tubes of the ADR paste, 1 tube of the travel paste, and then a Stride Animal Health Travel Ready bag that can fit up to like 3 days of travel packages. So that way you have a little travel bag to continue to use in the future. And then additional add-ons will be available. If you have that bleeder, if you have a horse that you need to increase stamina, endurance, get a little more run out of them, you can add the surge paste onto your package. Or if you have one that gets a little anxious whenever you're competing, you can also add in the Engage paste. So there'll be some add-on options. So this is going to cover, obviously, the foregut with the GastroFix. It's going to have 3 different gastric buffers. And then it's going to have an ingredient that creates a mucilage barrier to kind of help with that acid that's in the stomach and small intestine that might be splashing up during travel or competition. And then it does have some Butaprol Z to kind of help with that hindgut support. The ADR paste is going to help more in the microbiome. It's a mega pre and probiotic, keep the horses eating, and then also protecting that microbiome while they're under stress. Then you'll have the travel pace that's going to keep them drinking, that muscle fatigue for that stress and recovery, and then the surge pace or the engaged pace. So this should be coming out mid-August. We're waiting on the ADR pace. And so as soon as that's all ready, we'll be launching the new Travel Ready program. So some episodes that will kind of help support the travel pace information. So the chromium, episode 58. Chromium is an essential ingredient that's in that travel ready paste, helps with heat stress. It's also what's going to help act as a gatekeeper to utilize that glycogen into those tissues more efficiently. So lots of research done by the ingredient supplier that we purchased the chromium from. They've done a ton of research on it. It's a really cool ingredient, and Dr. Jimmy Nichols will dive in more specifically just to that chromium. And then there's also 2 episodes with Dr. Kopp about heat stress. So that will kind of just go into it a little bit more. So and then I'm going to stop this.